84 new cases were reported nationwide in the past week. That is the most cases in a week since April. An outbreak in South Carolina is driving the second surge. At least 114 cases have been reported there since October. Most of the cases have occurred in unvaccinated people. And joining us now to discuss the recent measles surge and its impact is Dr. Ricciardi, who is a professor at the GW School of Nursing.
Yes, and Doctor, thank you so much for joining us. I know it's a busy time. It's the holidays. People are traveling. What can we do to keep ourselves safe from measles as we travel?
Well, Michelle and Megan, thank you for having me and for covering this important medical problem, which is measles. And what can we do? Well, the first thing we can do is make sure that we're vaccinated. As you've heard probably many times before, vaccinations are a really important part of preventative health and public health. And the first thing we can do is to ensure that our children are vaccinated, and then perhaps if you're an adult and has never been vaccinated, to make sure you're vaccinated. That's one important contribution to keeping us safe. The second is to be on top of the public health statistics in your area. Find out what's going on, look at reported cases, and be aware of like, for example, the outbreak in South Carolina. Particularly if you're in a community where there's a large number of individuals who are not vaccinated from whatever reason, then that puts you on high alert.
Yeah.
The other issue to be aware of is that viruses, particularly the measles virus, tends to hang around for a while, like in a room. So if there's a crowded room with a lot of people in it, and you walk into that room, even within 1 or 2 hours later, and nobody's left in that room, there's a potential that you could be exposed to the measles virus. So it's important during outbreaks, and if you're not vaccinated and you're waiting to get vaccinated, or you're just recently vaccinated, that you minimize your exposure to areas where there's congregations of people, particularly indoors.
That's right. And Doctor, you spoke to the point of just how contagious measles is. How are hospitals and clinics preparing for the possibility of more severe cases or even complications?
Well, that's a great question. And one is to make sure that providers, nurses, physicians associates, all of us who are engaged in providing health care are alert and are aware of what's happening in our surrounding communities. So once we're on high alert, then we can then provide information and messages to our patients and our communities about what's happening, how to protect yourselves, and to ensure that individuals are vaccinated. Now, you probably are aware that the measles, mumps, and rubella vaccine is traditionally given to children at the age of 15 months. It can be given as early as 12 months, and it can also be given as early as 6 months to 12 months. But that, if you have an infant and you choose to give your child a vaccine at 6 or 7 months, they still would need to be required to get 2 more additional vaccines at 15 months and then 4 to 6 years. Mm-hmm. So there are things you can do as a parent if you are living in an area where there's an outbreak or a high risk of your child contracting the measles virus.
A word of caution for parents of little ones there. Mm-hmm. Doctor, when we're talking about vaccinations, how long do vaccinations last? And what does it mean if someone only has one of the MMR, the mumps, measles, rubella doses instead of both?
Well, specific vaccinations have different half-lives, or they wane at different times throughout life. One thing that's great about the measles vaccine is that it tends to be lifelong, and that's a good thing. And you do have a significant amount of immunity after the first vaccine, but it is recommended to, in an effort to give you approximately 97% protected if you were to get a second vaccine. So getting one vaccine, good thing. Getting 2 vaccines, great thing.
best thing there in that scenario, yes.
Absolutely. Well, we know one of the hallmarks of it is also that rash that takes over the body. So Dr. Richard Ricciardi, thank you so much for joining us and sharing this important information with our viewers.
My pleasure, and happy holidays to everyone, and be safe.
Thank
Happy
you.
holidays.
Yes, thank you.